Brilliant. So we've now started recording. Thank you everyone for coming along today to the Transport and Health Integrated Research Seminar on capturing the impacts of active travel. Today, I'm really glad to have Rachel, Asa and Osilia join us today. They have done some work in London, and today is going to be about thinking how can the explorations that they've done there be applicable in other parts of the UK, in particular in Wales, where the Think project is based itself. So without further ado, I'd like to hand over to our first speaker, Rachel.
Great, thank you very much, Amy. And yeah, very glad to be here. Let me just attempt to share my slides. Hopefully that is visible, even if it has a slightly odd banner around it. Is that okay? Good. Excellent. So I'm going to talk about specifically some of the impacts of low traffic neighbourhoods that we found in research in London. And it's going to be a slight whistle stop tour, but hopefully there'll be stuff of interest to everyone. I'm very happy to talk about generalisability, transferability, other contexts and so on in the discussion. Nope, hang on. That was the end of the slideshow. Let me just go back to the beginning. Yeah, great. So just to first of all set the scene in terms of where we started in looking at impacts of low traffic neighbourhoods in London. So basically back in, some of you may recognise this document perhaps if you followed cycling in London. So this document was from 2013, the Mayor's Vision for Cycling in London. And one of the things that it announced was £100 million to be invested in active travel infrastructure in 3 outer London boroughs. And this was something that made me quite excited, quite interested, because often a lot of the big ticket investment in cycling in cities, in big cities, is in city centres, it's in historic tourist areas, and not in the kind of suburban areas where many people live. Also, it was outer London, it wasn't, you know, Camden, Hackney, it was places that are perhaps more typical of other urban areas of the UK. But it offered Dutch level investment per head of population over 5 to 6 years. So really quite transformational level of expenditure. And it also included, the programme as it developed, included low traffic neighbourhoods, specifically in Waltham Forest, although these measures were also built from 2020 onwards elsewhere in London. So we were able to look at the impacts of a range of different active travel measures, but low traffic neighbourhoods figured strongly, and I'll explain a bit more shortly. Plus, they're also a measure that were built more and more in other parts of London. So people probably are familiar with what low traffic neighbourhoods are, but just in case not, these are basically whatever they're called in terms of a brand name. These are schemes for areas, and the idea is to filter out most or all through motor traffic from a specific area. So this is Walthamstow Village on the right, which was one of the first areas that was treated in Waltham Forest around 2016, and more followed also then later more in other parts of London. And so, yeah, modal filters block motor traffic, but not walking or cycling. And there are other permitted uses. So most low traffic neighbourhoods in London now have some blue badge exemptions, which affect some disabled drivers, meaning that they can go through some or all camera filters. So these measures, yeah, they can be camera filters, they can be physical measures like in the image on the left, but sometimes other things are done. Sometimes roads are made 2-way or 1-way, sometimes high streets are included. So the actual specific measures may vary, but the idea is to create a neighbourhood that is without through motor traffic, basically, without through private motor traffic. So an interesting measure, this is just an example, this picture of one of the measures that went in Waltham Forest around about 2016, where a lot of greening measures were put in place as well. So you could see there's kind of, new greenery. They also put in new bike lockers, seating and so on, play areas. So as I mentioned in the abstract, some of the findings I'm going to talk about in the next 12 minutes or so come from a survey, a longitudinal survey. So this is called the People and Places Survey, and this is kind of the main primary data source for our low traffic neighbourhoods research. This was the longitudinal study that we were very lucky to be able to run for 6 consecutive years, really, funded in all but 1 year by Transport for London. So the idea was that the survey was set up originally in 2015, 2016 to look at the impacts of that Mini Hollands programme in those 3 boroughs. So Kingston, Enfield and Waltham Forest. So we had a longitudinal survey with around 1,500 outer Londoners participating every year in both those 3 boroughs and in other outer London boroughs that were not mini Holland boroughs. So the idea was that this was a natural experiment approach. So as the infrastructure went in, we could see whether it was associated with travel behaviour change. And we had a control, we had a control group as well, so we could compare to background changes which might be due, for instance, to the weather. So we've published quite a lot from this survey now. And this just gives you an example of the kind of spatial data that we had. So this is the bottom half of Waltham Forest, if you're at all familiar with Waltham Forest. But basically the blue shaded area are some of the low traffic neighbourhoods that went in early on in Waltham Forest as part of the Mini Holland programme. The red line is the borough boundary and the black lines are new cycle track infrastructure. So you could see in this part of Waltham Forest, they were getting quite a lot of quite ambitious interventions. This wasn't the same everywhere in Waltham Forest. This wasn't the same everywhere in the Mini Holland boroughs as a whole, but it certainly was the case there. So I'm going to tell you a few results from the Mini Holland, the People and Places study. So just to say, first of all, that we adopted our approach to analysis based on the interventions that were going in and the results that we found. So initially we thought that we would compare those 3 boroughs that I mentioned that got the Mini Holland interventions with the rest of outer London. But it became clear quite early on that some of these interventions, some of the cycle tracks, some of the low traffic neighbourhoods were not appearing immediately. Things were taking years to go in, and there wasn't necessarily an effect associated with just living in a Mini Holland borough, a local authority that was putting things in. It actually seemed to be living near interventions that was making a difference. And in particular, when we started to look at the impacts of low traffic neighbourhoods, it seemed that a lot of the results that we were finding were driven by those low traffic neighbourhood areas, that it was basically we were seeing a dose response relationship, that where there was the most intensive interventions, we were seeing the strongest evidence of change. So here we've ended up with 3 intervention groups that we've compared basically, and this is in various of our papers. So we've got the low dose area, which basically means people living in parts of Mini Holland boroughs that hadn't got interventions. So like the north part of Waltham Forest didn't really get much at all, Chingford and so on. So that was the low dose areas. You were in a Mini Holland borough, but nothing had happened near you. The orange line is people who live near, for instance, new cycle tracks, new pedestrianisation schemes and so on, but who didn't live in a low traffic neighbourhood area itself. And the grey line here are people who lived in a low traffic neighbourhood area and usually also near to a cycle track scheme, pedestrianisation, various other types of active travel schemes. So basically the grey line is the one with the most intensive intervention, followed by the orange, followed by the blue. And what we're tending to see is this dose response relationship. So this is likelihood of driving, likelihood of past week driving from our the travel survey that we administered to people year on year. And this shows that the results that we're finding in terms of reduced likelihood of driving are only in the high dose low traffic neighbourhood group. In the other groups, we're not seeing a strong enough response. We're not seeing clear evidence of a reduction in driving. But in the low traffic neighbourhood areas, we are. Now, the sample size for this group is relatively small and uncertainty is generally quite large, but some of the data that I'll be telling you about in a minute sort of corroborates the suggestion that low traffic neighbourhoods reduce the likelihood of residents driving. We've also looked at change in active travel, and these results were stronger, as you might expect. It's easier to find a change in active travel than a reduction in driving, because obviously only some of the additional active travel comes from driving. So again, this is the 3 intervention groups. So the blue ones are the low dose, the orange ones are the high dose, but not in a low traffic neighbourhood, and the grey ones are the people who've got the most interventions. And you can see that the evidence for increased active travel is strongest in those low traffic neighbourhood areas where people are seeing the most interventions. But there's also some evidence for people who are living near other intervention types as well. What we're not seeing is any impact of living in a Mini Holland borough, but nowhere near a cycle track or a low traffic neighbourhood. So it seems to be actually putting stuff in, and particularly low traffic neighbourhoods, that is making a difference to travel behaviour. The paper that we published most recently, I haven't got time to go through the details of this, but the paper finds basically that this increase in active travel has led to a health benefit published in the Journal of Transport and Health, has led to a health benefit, health economic benefit that's around 10 times the programme cost, and that this benefit is particularly concentrated in those low traffic neighbourhood areas. So we're using the active mode appraisal tool, which is a Department for Transport tool, basically to model the health benefits of physical activity related to these schemes. So there's more details about the methods in that paper. We also found in the low traffic neighbourhood areas reduced car ownership. So this is another paper that we published in Transport Findings in this case. And this is where we use driver and vehicle licensing agency data to look at changes in car or van ownership. Again, we have a control group, which was the rest of outer London. And here you can find that, again, we're getting this kind of dose response relationship. The places with low traffic neighbourhoods are seeing a reduction in car or van registration, as are the other areas where, as I said, there was cycle infrastructure going in, but there wasn't a low traffic neighbourhood specifically there. So again, it kind of mirrors the picture that I was talking about earlier, that the places where most stuff happens, including particularly low traffic neighbourhoods, you seem to be getting the strongest impact. We also looked at road injuries, which is another important health impact, I think. And this is using STAT19 road injury data and comparing the low traffic neighbourhoods here in Waltham Forest with changes in road injuries in the rest of outer London. So what we're seeing, the red line there is the background trend, which is unfortunately an increase in road injuries. But inside the low traffic neighbourhoods in Waltham Forest, we're seeing around a 70% reduction in road injury risk. And it doesn't seem to be displaced onto boundary roads, although we're doing more analysis with more years of data to follow that up. But so far, it's looking promising. I wanted to spend the last few minutes of my talk saying something about the pan-London low traffic neighbourhoods that we've been studying. So as I mentioned, there were more low traffic neighbourhoods introduced across London in 2020 to 2021. So we were able to include some of these in our analysis of people and places data, because some of those outer Londoners live near those new emergency low traffic neighbourhoods. Now, these schemes were often quite rough and ready. They didn't look nice, like the Mini Holland schemes that had, a substantial amount of funding. So this is an example from the London Borough of Hackney, where you can see it's not particularly beautiful public realm-wise, but it's doing the same functional job. So I was quite interested in these and the impacts that they might have. So there's a few studies that we've done looking at these that have been published. So this is one which I worked on with ASA, who'll be presenting on School Street shortly. So this was quite an interesting one. This was where we were looking at changes in motor traffic in low traffic neighbourhoods introduced in London between 2020 and 2021. So this was where we basically, it's published in Case Studies in Transport Policy, and we did a systematic review of local authority traffic monitoring data, which was kind of an interesting use of systematic reviewing. I think it was also quite onerous, given that the data was presented in lots of different formats, but we were able to review data from 47 schemes and around 600 traffic count points. And you can read a lot more about this in the paper, a lot more, lots of different findings. But the main takeaway for this talk, I think, is, so if you look at the bottom graph, that's the change compared to expected change. We were able to control for background changes to some extent using Transport for London's traffic flow data. So the bottom graph is showing you that there's a skew to the left, and that's showing you traffic monitoring data from inside low traffic neighbourhoods. And it's basically showing that the trend is traffic tends to reduce, motor traffic tends to reduce in low traffic neighbourhood areas, which is good. It's what you might expect, but obviously reassuring. But the graph at the top is the really interesting one, because that's showing traffic monitoring on boundary roads, where the worry is that traffic will get displaced to boundary roads. And what's interesting there is there is no consistent picture, that you've got similar numbers of increase and decrease. So it doesn't seem like there's a systematic pattern in terms of the boundary roads, which suggests, I think more research needs to be done here. It's quite an interesting topic with a lot of methodological issues, but it suggests that there's traffic evaporation going on, which is reducing the amount of motor traffic on many of these roads, which is interesting. We also found in the emergency low traffic neighbourhoods, we found again a trend to reduced road injuries. So this is from another paper, and this shows you again, the red line is the background trend. Because this is during COVID times, the background trend is actually a reduction because there was less motor traffic generally, but the reduction in the low traffic neighbourhoods area is substantially stronger. And in this case, it was actually pedestrians, benefit to pedestrians that were driving the change, whereas previously in the Waltham Forest low traffic neighbourhoods, we'd found benefits for all modes, but this is particularly benefiting pedestrians, which I thought was interesting. Again, we're looking at this with more years of data, so we'll be able to say more about it, hopefully. I just wanted to finish with another couple of studies briefly. So in Lambeth, there's a paper we've published using MOT data on driving, which uses the fact that there are controlled parking zones in Lambeth, so we can match postcodes to vehicles and so on. And basically the takeaway from this study is that there is a decrease of around 6% relative decrease in terms of driving in the low traffic neighbourhood areas. You can see the red and the blue lines diverging, and you can see that basically the control group and the LTN, the people living in LTNs, are seeing different trends in terms of the amount of driving. I also wanted just to highlight before finishing that there's a study that I'm not involved in that might be of interest to people that looks at air pollution using direct measurements of air pollution in 3 LTNs in Islington by Yang and colleagues, including Aldred and Nazelle, and they found a reduction in nitrogen dioxide in LTN areas and also on the boundary road count points, which I thought was quite interesting. We haven't done research directly on air pollution ourselves. So I think just to summarise, we found motor traffic levels reducing inside the low traffic neighbourhoods. We found no systematic pattern on boundary roads, more walking and cycling, some evidence of reduced driving and car ownership, not as strong as the evidence on more walking and cycling as you might expect, and some evidence of reduced air pollution and evidence of injury reduction as well. And I think I'll finish there because that's 16 minutes, sorry.
That's fine, Rachel, that's perfect. Thank you so much. Does anybody have any questions? You can put a question in the chat. Just a reminder, it is being recorded, and we will put the recording on YouTube if you to be aware of that. But you can also request to have your mute taken off and your camera made available if you want to ask a question that way. Otherwise, we'll move on to ASA and we'll have a wider discussion afterwards. Any questions? I have a quick one about, did you say traffic evaporation? Is that what it was called?
Yes.
So I've never heard that term before. Does that just mean where it's literally like the idea that it's disappeared, it hasn't been pushed out somewhere else, it's just there is less of it?
Yes, exactly. So it can be a range of things happening. It could be, for instance, someone choosing to walk or cycle instead of drive. But it might be the fact that people change where they go to, that instead of driving to the supermarket, you're walking to the corner shop, or, you know, there may be a whole range of different changes. I mean, personally, I hate the word evaporation because it sounds magic, but it just means people do things differently and there is less traffic as a result.
Brilliant. Thanks for clarifying that. Brilliant. Tom? Your mic's allowed if you want to ask a question, Tom.
Thanks. Yeah, hi, Rachel. That was really interesting. Thank you very much. I'm Tom Porter. I'm a consultant in public health in Cardiff. My question was about, has anyone looked at the costs of individual costs to individuals and households of transport pre LTN and during LTNs, or comparing LTNs with areas without LTNs, i.e. if we think people are using their cars less and are using active modes and or public transport, is there what one might expect to see a reduction in household cost on transport because cars are expensive, but obviously if they're keeping their cars but just not driving them less. So yeah, has anyone looked at that, please?
I mean, that's an interesting point. I think it would be kind of difficult to look at because you would need, I mean, would you be hypothesizing from the amount of driving that people are doing, which we have from our survey, but we have minutes of driving, so it's a bit of a jump to go from that or in terms of the Lambeth data, that required us to have the CPZ and to match the data. So we only have that for 3, that's only a relatively small amount of data. Or would you ask people, I mean, I guess within our longitudinal survey, we could have asked people about past week transport expenditure, but we didn't. It was already super long, but it would have been interesting to do so. But no, thank you. Interesting point. And yeah, potentially there could be, definitely.
Great, thanks.
Thanks, Tom. If anybody else wants to ask a question, you can raise your hand with the virtual. So we've got Joe's ask a question. Thanks, Rachel. Really interesting work. Does your longitudinal study suggest that LTNs need to be in a place for a certain period before they impact on driving behaviours?
I'm super happy to. So there's a couple of questions that I could respond to in the chat. If we want to move on, I could just do that.
Okay, brilliant. If we want to. Rachel will address those in the chat for people. Okay, Asa, would you like to do your presentation now, please? Thank you.
Yes, thank you very much. Great, let me get my slides up. Okay, wonderful. Okay, great. Can everybody see that? Let me. There we go.
That's great. Well done. That's
perfect. Thanks very much. Always a challenge. Yeah, thanks very much, Amy. Yeah, so my name's Asa. I'm a research fellow at the University of the West of England, and until very recently, a postgraduate researcher at the University of Westminster at the Active Travel Academy. So you have to apologize for all the logos. But yeah, so I'm going to be talking a little bit about the research that I did for my PhD on school streets and focusing specifically on some of the travel behavior impacts. So there's some resonances with what Rachel's just talked about in terms of similar approaches to kind of trying to understand the impacts of these sorts of interventions. But I thought a good place to potentially start is with the sort of problem of school travel in the UK. What is the sort of issue that we're having, and why is it important that we have interventions that are tackling this? And so some of this is kind of, I think, pretty well known, but other parts of it maybe less so. So one of the sort of headline figures is around independent mobility and the sort of decrease in independent mobility. So the sort of really shocking decline in that, which is happening across kind of global north countries. In 1971, we had 86% of children in England aged 7 to 11 walking home from school alone. In 2010, that's 25%. So that's a really big change in travel patterns. But distance is also a really big factor in this as well. So in lots of the studies that have looked at the determinants of active travel to school, what leads people to choose to walk or cycle to school, essentially distance is the biggest factor, and that distance has been growing over time as kind of school choice policies have increased. We've liberalized how school choice, and there's a much larger debate about whether about the impacts of that. But from a purely looking at this from a transport perspective, it's increased the distance that children are traveling. So that distance sort of has increased by 13% between 2000 and 2010. I don't know where it is now, but I think it's interesting that it's not just about planning, but also about these sort of higher level education policies also have an impact. And this kind of excess commuting, as has been described, has a significant impact on congestion. So TfL estimates that in London, 20% of peak time traffic is attributable to the school run, which is really significant. And then there's all kinds of downstream impacts in air pollution, lower physical activity, road safety that are kind of more that we understand as a problem with school travel. And this obviously had particular kind of consequences during COVID-19. Car dominance in the sort of space outside of schools meant physical distancing was really difficult. And so yeah, that's something that was a kind of key rationale for what came next, which was the sort of introduction of school streets. And so for those who are maybe less familiar with these are temporary and recurring closures to the streets outside of schools. So the kind of direct streets outside of the school. And there's kind of two ways these have been approached. One is sort of a temporary barrier using volunteers or school staff to sort of manage this closure, and others using kind of automatic number plate recognition cameras to issue fines to drivers who go in. in both cases, residents who live within the closure are usually exempt from the closure, and it's only in place for usually an hour or 45 minutes the pickup and drop off times. So they're relatively small kind of intervention, but I think often it's the feeling is amongst a lot of practitioners I've spoken to that it's a small intervention that has that tackles a lot of the kind of main issues that that are faced by school travel. And so I thought, yeah, it would be a really interesting kind of focus for the research that I was doing. And I began the research in January 2020, which is an auspicious time to kind of begin anything. And this is a chart of kind of the number of school streets installed in London every month over the last few years. And there's a big increase, a big jump, right? Around September 2020, where as part of the kind of large response to the pandemic, there was a kind of a big mobilization of funding and effort within a whole number of local authorities within London to implement school streets. This was seen as a very important thing for sort of safeguarding the school environment during COVID, and as well as these active travel benefits. And so there's over 200 schemes installed ready for September 2020, which is a really huge transformation and a significant kind of mobilization of resources for this, which I think is really interesting as well. And that was also a focus of my research, was looking at some of the policy kind of processes that went around that. And this is a very complicated flow chart, which I'm not intending for anyone to understand, but is only to sort of say that researching during this time was very difficult, and original research plans kind of flew out the window. And a lot of the research relied on kind of rapid response interviews with practitioners in London, but then also drawing on a number of secondary data sets that became available over the time to kind of piece together a story of what was happening kind of as it was happening. And a lot of that came through secondary data on the locations of all school streets in the city, and secondary data on mode of travel to school. And so I'm going to be talking a little bit about both the qualitative and quantitative sides of that research right now. So the main kind of quantitative data set that I was using was the STARS data set. So this comes from Transport for London's sustainable travel accreditation system for schools. And this is a voluntary program that a number of schools in the city sign up to. One of the requirements is they submit an annual travel survey on a specific day. It gives a sort of a snapshot of the mode share in a specific school. It's a bit of a patchy data set. Not all schools report every year. They don't do them all on the same day. And it's not a supervised survey, so they, the schools we have to sort of trust the schools are doing it in a robust way. But it is also around 1,000 schools have been involved in some way. And then the kind of more constrained data set that I used, there was about 500 schools that were involved. Unfortunately, there were no surveys during the kind of specific COVID school year of 2019-2020, but there were decent amounts of surveys on either side. And it's the only kind of a data set of its kind. We don't measure school travel in any other way regularly. And it's also longitudinal if patchy, but it does mean that we can kind of retrospectively look back and see the impact of a really, something that happens that's difficult to research in the moment. So like the explosion in school streets that we saw. And so I was able to do a kind of sort of similar natural experiment approach to what Rachel was talking about, but looking retrospectively. And so there's about 100 schools that I was able to look at that had school streets over this period, and about 400 schools that didn't, that act as a sort of comparison group for the research. The findings were generally pretty positive. The sort of statistical analyses around this showed a sort of average effect size of of a school street of a 4% increase in active travel and a sort of 4% decrease in driving associated with school street. But there's a lot of other things going on in this as well. It's a really complicated time for travel, and this shows the sort of distribution of changes. So each dot represents a school, and those on the left side saw a decrease in driving, left side of the dashed line, and the ones on the right side saw an increase in driving. The school street schools are the top, and the control groups are at the bottom. And generally, it's kind of a picture where there's a lot of different outcomes happening for schools at this time. But among the school street schools, there's more that are seeing a decrease in driving. It's kind of stretched out more there, and the extreme decreases in driving that we see in the far left of the graph are more likely to be happening in school street schools. Whereas with the control schools, there's a bit more of a trend over to the right side, so a few more are seeing increases. This shows that a school street is not essential to decrease driving, but that it seems to help to some extent. And this is the same with active travel. It's actually a slightly more kind of clear picture here. So the ones on the right are seeing an increase in active travel, and we see there's a lot of the extreme increases in active travel that are seen are at school street schools. But there's an overall picture across all the schools as well towards an increase in active travel at this time as well. So this is, a positive picture, but I think important to kind of recognize that these are small interventions within a kind of a large number of different kind of changing travel patterns at the time. And but I think we can be kind of quietly positive about the sort of behavioral impacts of this kind of quite small intervention on the uptake of active travel. But one of the kind of interests I had was really, the why question, why is this happening? And there isn't actually much indication of the mechanisms that are driving this change that we can draw out of this data. It's very kind of the sort of nature of this analysis is that the kind of main variable we're looking at is the presence of an intervention or not. But there's obviously a lot more that could maybe help to drive active travel with a school street. And I thought there's a lot of potential for insights from the learned experience of practitioners that I recorded in my qualitative data to kind of help unpick this. These are really interesting conversations. But there wasn't a lot of agreement across the people I spoke to about exactly why a school street sort of worked. And there are some really interesting different dynamics that came out. So these are some of the themes. These are sort of 4 of the themes of the different sort of ideas that people had about why the school streets were working. Some emphasized that, it was a longer term thing about providing a sort of alternative to an image of an alternative to kind of car dominance to children that would form positive life habits over a lifetime. And, we shouldn't be constraining our analysis to, the there and then. Others looked at it around it being either a carrot, so the improved environment for walking and cycling, attracting people to walking and cycling, and or a stick, so the decreased inconvenience of driving, or a sort of a combination of the two. My sort of carrot stick over there. And then others emphasize the interaction with other behavior change measures going on in a school. So cycle training, action within the curriculum, cycle parking, all kinds of other stuff happening. And then I think interestingly as well, emphasizing the sort of the need to change parental norms around school travel. So just providing, making, denormalizing driving to school by putting it elsewhere, showing kind of demarcating the space away from kind of car use in that space, and perhaps kind of forcing people to rethink their travel modes through that. So I think there's some really interesting things pointing here. There needs to be more research to kind of dig into some of these dynamics a bit more. But this was some of the themes that kind of really came out of that, which I think are kind of helpful directions for sort of future research on the mechanisms of change that are going on here. But yeah, that's the kind of main bit that I have to talk about. So yeah, interested to hear any questions about that as well.
Brilliant. Thank you so much, Asa. Just as a bit of a point in terms of some of the other resources Think have got on the base of what you just said there with the sort of qualitative questions. So we had a presentation in our conference last December on motor normativity, and this idea about how, our norms and our culture, how we set up the spaces that we frequent, are very much geared towards the cars as the perceived norm. And so that might be something that some of you want to watch back. I'll put a link in the chat. And also we've done an exercise with some of our Think members around active travel systems mapping, and it's really interesting where your data with people like there's no particular agreement about why those things work, and actually all of those things that you mentioned were captured in our mapping exercise, because different people were suggesting that different things are needed for this sort of almost like a holistic approach. Different areas, you need a sort of different menu of different things to make it work. So I'll put a link in the chat to everyone who's here today, so you can look at both of those things if that's useful before I forget. Is there any questions from anybody else? Just a reminder for anybody who's just joined, I will take you off microphone and put your camera on, mute and put your camera on if you want to ask a question, but we are recording this for, it will be put on YouTube. So if you don't want to be appearing, you can just ask in the chat. I will let Eleanor ask a question. So,
okay.
Yeah, go ahead.
Thanks. So I'm from Greater Manchester, and we've now got school streets, but they tend to be so close to the school as actually not really to disturb very much of the school journey. Plus, they're currently all volunteer led, although there is a plan to change that, and that is proving very unsustainable. But the model is very much of a my background, population and parent-led approach to it, which it has a big danger of increasing inequalities, because the parents who are most likely to be able to volunteer tend to be in the more middle class areas and so on. So I was just interested in the impact, well, several things, but one is on how schools streets work within a wider context of more travel restrictions, rather than when they're just a little tiny bit of your journey is suddenly a bit safer, and whether you'd been able to look at that.
Yeah, that's a really interesting question. And one thing I had hoped to be able to look at with this research was the interaction with low traffic neighborhoods. But unfortunately, the schools that were sort of doing robust surveys, there's only a handful of them that were in low traffic neighborhoods. So there wasn't really any kind of meaningful analysis that could have been done on that. I think it's interesting about these different design aspects of school streets, because some in London have actually, in more suburban areas, have explored kind of quite larger closures with that are taking up a kind of higher proportion of the school trip. But the sort of flip side is that there's a kind of much greater amount of exemptions that are needed, and you have a much larger amount of residual traffic that's moving through. And so perhaps that carrot of a kind of improved environment is slightly diminished when you are increasing. And so I think that's and there were sort of different ideas that came out from some of the practitioners I spoke to about the different design philosophies around whether you just have a small closure that you can really control, and then that is a space that's as car free as possible, or do you try and kind of deconvenience the driving as much as possible by kind of increasing that closure size? And I think there's no easy answer on that. And I think being able to break this sort of analysis down by different scheme types would be really interesting, but it was difficult enough just finding out where all the school streets were, never mind how big they are. So, but yeah, I think probably a more closer piece of research on that would be really interesting. I agree.
Simon, you should be able to take yourself off mute now to ask a question.
Lovely, thanks. Yeah, thanks, Asa. That's really interesting. Thanks for the presentation. I just had a question around sort of the more sort of physical infrastructure that went in alongside it. I think that your sort of last picture probably touched on it quite nicely, just in terms of a comparison between that type of intervention against where we've just got sort of the camera enforcement. I think in Wales at the minute, Cardiff have got obviously quite a few school streets, and a few other LAs are starting to look at it, but it seems to just be that sort of camera only enforcement. So it doesn't really sort of change the look and the feel of the street to that sort of more people friendly space. I just wondered if you had any data sort of comparing sort of the two styles of interventions there.
Yeah, I mean, only anecdotal, because that was the one on that picture was around the corner from where I was living, and
Okay.
And so it's interesting to see that kind of a full. That was a kind of a complete closure of the street, 24 hours. Essentially, it was a modal filter that then was developed into a kind of public realm scheme very recently in South London and in Southwark, and it is, and that's happening in a few different pockets in London. I think Tower Hamlets were doing that before the sort of change of tack in their policies, and I know that's being explored in Hounslow, and yeah. So I think it's a really interesting. I mean, I think providing and this is also a sort of way that it's been approached in other countries as well. In Barcelona, that's really the kind of the way that they've gone for a sort of design-led approach rather than a traffic-led approach.
Yeah. Okay.
And I think there are a lot of benefits to it in terms of creating a kind of full public and sort of new public space in front of the school. But obviously, in terms of budgets and all of that, it's I mean, I think it's something I'm really interested in. Think there should be more research on, but haven't been able to cover it in my own work. And I think given the sort of small numbers of schemes that are doing that, I think it would take a focused piece of work. But yeah.
Cool. Thanks.
Thanks, Simon. There's a question in the chat from Angela. Have you been able to unpick the impact of links with wider parent journeys, linked trips? Presumably during the pandemic, greater working from home meant more parents working from home. I don't know if you were able to touch on that at all.
Yeah, I think that's really interesting. Unfortunately, because it's the data is not individualized in any way, it's kind of hard to pick some of that apart. But what I was interested in finding was that in general there was a background trend of a kind of increase in driving at schools being more likely during this period, and so that was not what I was expecting necessarily, because I kind of was operating on this assumption that more people working from home, perhaps there'd be more time available to active travel. So we had this increase in driving and an increase in active travel sort of simultaneously, which was sort of this sucking up, I think, some of the public transport part of it. And so I think it's difficult. Yeah. I think that COVID picture was very different in different schools. That's kind of what I gleaned from that sort of finding. But I think, a more kind of individual that I think moving back to the onward travel portion is obviously a really big problem for school travel. And I'm doing some research soon that's kind of digging into that a little bit more about what are the actual barriers for parents walking to school, and whether a school street or other interventions actually intervene in those problems, those additional journeys and trip chaining and things like that. Because I think it's a really important question. If the school street's not kind of disrupting that in any way, is that going to lead to a behavioral change? Don't know. I mean, but that's where you get into the combination of measures, because you have obviously park and stride, parking kind of nearby, and then being able to kind of walk in is perhaps also a kind of a measure that really helps with some of those issues as well, for those people who aren't able to change their whole journeys to active modes. But yeah, I think it's a really important question within this.
If your question is very quick, Mike, we'll take it. Otherwise, you might want to save it for the discussion. I'll leave that up to you to decide.
It's first of all, thank you, Amy, Asa. It's more of maybe an opportunity, not so much than a question. Basically, I work for ACOM. We've got a client who's undertaken, as part of Levelling Up Fund's Safe Routes to School programme, 11 schools within the city centre. We've split the approach between placemaking or space reallocation and what we would refer to as line and sign, which is a more traditional approach, as you've highlighted here. We're going to undertake trials in the new school term following the summer holidays. I wondered if there's an opportunity here to maybe do some research on the back of that. And again, happy to discuss this offline later on, but I think in terms of research, and that, it's an interesting approach, because from placemaking, and apologies for jumping in, we're looking at initial trials with the aim of eventually delivering more permanent measures. And I guess, like Simon, I quite like the scheme you showed at the end there and gave me some ideas, but I think there's plenty of scope to take some good research on this and hopefully incentivize schools across the UK, because I build on what Eleanor said, that if you have a lot of volunteer schemes, which is why we all kind of propose a placemaking, it's that human resource or social capital you're reliant on, and it puts the pressure on teachers often who aren't comfortable dealing with that, and irate parents. So we're trying to see what the benefits are of both approaches, and I'm hoping longer term will be the placemaking ones.
Thanks, Mike.
That's
Sorry,
really, yeah, go ahead.
can I move on? Sorry.
Yeah. Let's
Otherwise we're
chat
going to run
later.
out of time. Yeah.
Yeah,
You guys can connect afterwards. That's brilliant. Thank you so much for that, Mike. I would like to invite Ercilia to give our finest presentation, and then if anyone can hang on afterwards, we'll have a discussion period. So off you go, Ercilia.
Thank you. Welcome everyone. Just give me a second. I'm gonna figure out what the slides are. With this one.
While Ercilia's setting up, if there anybody does have to leave before the end, because we will be continuing until 3:30, if you want to leave any thoughts, questions, contact me at whatever in the chat, then we can pass that on to our speakers if you do need to dash off. Okay, over to you. Thank you.
Brilliant. Thank you so much. Can you see the slides okay?
Yeah, perfect.
Perfect. Okay. Hello, everyone. My name is Ercilia. I'm a senior research fellow at the University of Westminster's Active Travel Academy, so working with Rachel and previously with ACE as well. Today I want to talk to you about a paper we've been writing based on a bigger study, which is the project called LTNs in London, which is an NIHR-funded project looking at the impacts of LTNs in London. And just as a caveat, this is one very small part of a lot of things we're doing as part of the study, but I thought it was kind of interesting to bring it as another ways where we can discuss impacts, especially looking at how residents make sense of or like talk about LTNs and how can this help us understand controversy, but also understand how we communicate around those schemes. So I skipped this. I think Rachel really well introduced what low traffic neighborhoods are, and I guess most of you know. I just highlighted to myself to remind that it is very controversial measures, and unfortunately like creating a lot of controversy. So because of that controversy, we've been looking at the schemes. Also, we've been particularly looking at how residents talk about the schemes in our study. And more broadly, as I mentioned, this is part of a broader NIHR-funded project, which has a lot of different research questions. It's a mixed methods project, so we're combining a lot of different quantitative data collection with some qualitative data. I'm particularly focusing on the last two questions of the study, which are looking at the experiences and perceptions of residents of schemes, but also how can policymakers navigate controversies around the schemes. And if you're interested in knowing more about the project, I put you the QR code that should lead you to the project website, and I'll have that again in the last slide. So to respond to that kind of questions around residents' perception and experiences, our main strategy has been to conduct go-along interviews with residents in 3 schemes in London. We've been interviewing them twice with a gap of a year and a half. And we identified those cohorts of 20 residents through leafleting all the homes within the LTNs and on the boundary roads. And we kind of selected participants to make sure they represented different views, different also demographics. And once we contacted the participant, we asked them to take us through the LTN area and discuss with us their lived experience of the schemes. We used these methods because it was very interesting to really discuss the schemes as we were in the area and really trying to understand how participants engage with that environment and how they make sense of it. But also because we think go-along interviews are particularly interesting, giving us an understanding of how a social order around is produced and how social interactions are formed and changed by those schemes. In particular for today, I'm going to focus on those kind of responses to our questions or discussions we had, which are looking at the interactions between drivers and cyclists, which were kind of one of the themes that we found in the analysis of interviews, which I think is quite interesting because it's where a lot of the kind of tensions emerge. And I also, as I said, there's a lot of different ways we can analyze our qualitative data. As I say, it's like hundreds of interviews, hundreds of hours of recording. But one way kind of we try to make sense of them is also refer to this concept that Amy highlighted before of modal normativity, or as been called as, again, more broadly, automobility, really trying to understand how we live within a system of kind of infrastructure, technological innovation, policies, norm and belief that really prioritize vehicles in transport policy and planning, but also that lock in car dependency. And how also certain ideas around what is fair and unfair, so discourses around morality as central to reproducing automobility and motor normativity, especially in the way we accept or normalize what is allowed on roads, what is allowed in public space. And one interesting example is, for example, around the way media reports road injury, which has been covered by a paper by Rachel and colleagues, looking at, for example, the fact that pedestrians and cyclists will be described as being hit by vehicles, but not by drivers or driving vehicles. And how often, like in those media reports, agencies script it only to pedestrians and cyclists, but not to drivers. And how also like this kind of, in this system in which we live of motor normativity, automobility, intertwines with processes of identity formation. We say how we can make sense of ourselves, making sense of the way we interact with others, and how this would filter and kind of affect the way we narrate conflicts between, for example, different people doing different things on roads, so different conflicts between drivers and cyclists, but also how this opposing some sort of transport identities will shape the controversies, I will show in the data. So to analyze our interviews, we've been referring to a technique method, which is called ethnomethodology, which is looking at trying to understand how controversy we can use to understand controversy between different road users, as been used before by other authors. And particularly within ethnomethodology, we're using membership category analysis, which is a method which allows us to understand how social norms around a specific practice event are formed. And it's particularly useful to when we can look at norms being disrupted. So, for example, the LTN represent a moment in which the kind of the social norm around who's allowed on the road can be disrupted, and so a lot of the kind of social norms emerge and come to the fore. And within membership category analysis, trying to analyze how different categories of people, objects are mobilized in the stories about that phenomenon. So how people look at other people and objects and themselves in the way they narrate the LTN, what the LTN is doing, and the way they responded to our questions in the interview. And also how these categories are used to kind of create the different group us versus them categories and creating different paths. So we wanted to use this method to explore how different individuals negotiate road space and how this categorization contribute to developing a new account of in support of opposition of low traffic neighborhood. And we've been looking at the transcripts for one specific scheme. So this is the analysis based on 14 interviews with 20 participants. And we've been coding them, looking at the occurrences where people were talking about themselves or others as drivers or as cyclists. And we identified two, what we call them stories about the LTN. One first story is the story about the good driver and the responsible cyclist, which is mobilized by those participants that opposed or strongly oppose or tend to oppose the scheme. This is a story where the driver is narrated as someone who has a priority on the road. Participants see drivers as legitimate and because it's regulated by licenses, insurances, and different regulations, as opposed to other kind of, for example, the cyclist who is not regulated. It has also a strong moral framing around rights and responsibility, and the right to be free to pursue one's life without interference. We're using Jonathan Aid's Foundations on Morality around so how different people would refer to different mechanisms which allow us to categorize what is fair and unfair in society. So in this context, like discussions around responsibility and rights should be strongly accounted for deciding what is fair. And for example, one code we can look at is telling us how one of the participants tell us about how it is making the scheme is literally making it impossible for them to do anything with the car that they bought, although they are entitled to buy it and they're using it sensibly. So this is kind of referring to things that are done sensibly in sensible amounts, driving sensible amounts, they're driving within the legal framework. So the participants narrate the driving to the LTN as something that can be seen as environmentally friendly because they would take shorter routes. They would drive to care for family and for the community, for example, giving lifts to someone that needs a lift. But they also allied, for example, anecdotes where driving is seen as beneficial for public safety, for surveillance, and so on. So they construct this character, we say, of the good drivers, and which is kind of characterized by all these attributes, which is opposed to what they describe as the responsible cyclist, which is a necessary counterpart to the good driver, or someone which is shouldn't be allowed on the roads because it's not regulated and keeps violating the rules of public space. And this kind of is reinforced by, for example, conjuring this child cycling under responsibility of parents, highlighting how cycling is often compounded with like danger, endangering children. So this quote, for example, highlights how one participant saying how they really need to do is to teach them how to cycle properly, so parents should teach children how to cycle properly, because they don't have common sense in the way they use the road. So referring again to the idea of like appropriate use of public space and regulated use of public space. And interestingly, they also mobilize this idea of responsibility to highlight the harm to oneself. So for example, in this quote, a participant recounts a moment in which a cyclist got hit, and they say there was a cyclist doing what he shouldn't have been doing. He was waving and he was killed right in front of me. So again, this irresponsibility, which is kind of used to responsibilize someone for death or injuries. In this story about what the LTN is doing is kind of forcing the driver to become not allowing the good driver to be a good driver and creating space for the responsible cyclist. There is also new characters that appear, and in membership category analysis terms, we call it characters appearing on cue. So they often refer to cyclists as themselves, as the cyclist drivers, as someone who instead should be allowed, and highlighting how one is a good cyclist, one is also driving, and opposing this cyclist drivers to the irresponsible cyclist that doesn't know how to move on the roads. And in this story, the LTN, as I say, play a role which is disrupting the good driver and the moral order in which this good driver lives. So it's forcing the good driver to adopt unlawful behavior because it's not allowing the good driver to, for example, driving environmentally. It's not allowing them to care for the community. So it's forcing them to take more circuitous journeys, and so on. And for example, one of the examples, a lot of participants reported is this feeling that because of this scheme, they have to drive for longer, and they have concern that this is going to mean that they will pollute more, as you can read in the quote. So this was the first story we identified. The second story was a story that participants that tend to support or supported the scheme told us about what is the scheme is doing by again highlighting these two opposite characters, which are now the vulnerable cyclist and the aggressive driver. They now shift kind of moral framing. If before it was a lot about kind of rights and responsibility, we identified this being more about care and harm versus harm moral framing. So there is a lot of, also the tone of the narration is very different. There's a kind of the different kind of languages are used to highlight what the scheme is doing. So there's a lot about the vulnerability of cyclists in relation to the spatial presence of vehicles. Again, rather than the drivers, as I mentioned before, there is always a shift in agency. There's also bringing up a lot of ideas around danger, fear, and aggression that are experienced by participants who might cycle in the area or who are themselves cycling in the area. And recounts of like anecdotes where participants felt they've been squeezed out or intimidated because of the presence of vehicles. So one participant told us, I was frightened of cycling up and down this road before the LTN was implemented, because there are cars parked all over the way, and I felt I was in danger and I got knocked over. So again, in this pair now, the vulnerable cyclist is supposed to what we identify being the aggressive driver. So drivers are brought us in as impersonal and indirectly. It is the car that went, so they create this idea of an expectation of a road order where the driver is constantly disrupting it. And they talk about is responsible drivers or mad drivers, of course, using problematic language. For example, this quote in which a participant is saying, suddenly the driver went mad and it was going on the correct side, and then he suddenly moved into the wrong side and came straight towards me and knocked me over. A lot of the attributes that we found resonate a lot with what Fabian and Aldred identified being the rogue driver, this exceptional driver, which is kind of disrupting the order of the road, but is kind of distinguished by the good drivers that we saw in the previous account. Again, there is a highlighting lack of care towards the other kind of participants in the roads, and the fact that vulnerability remains even when, for example, cyclists or people walking take efforts to be visible, for example, using high-vis jackets or kind of dressing appropriately. And in this sense, this new narration is understanding the LTNs as something that is potentially saving the vulnerable cyclist from this aggression, from this feeling of being constantly vulnerable. So removing the risk and improving the experience. And there is a lot of kind of quotes in which participants say us that they definitely feel safer on the bike, for example, within the LTN, because they feel the number of cars is going down and they feel better. There is also a report by participants on uptake in cycling. For example, they highlight many times how there's a lot more people cycling, a lot more children cycling, as in the quote, the participant saying, it just seems like they put in place a lot more people cycle, especially families, people that have kids. But also they talk about reduction in other forms of vulnerability of harm, for example, talking about less air pollution, and they talk about the air feels a bit cleaner. And if on the other story one, this kind of pair of the children and parents was allowed to show irresponsibility and danger, in this story, they're mobilized to highlight how nice the atmosphere within the LTN is. So this is one way we made sense of the data. Again, it's difficult to come up with an understanding of simply a kind of narrative understanding of impacts to looking at qualitative data, and we felt that it's important to look at them through different theories and framework, and this is certainly one that helps highlight how LTNs is seen as something that disrupts automobility, and because of that really forces people to remake sense of how to be on the roads, and how also that kind of pushes a change in the social order where the good driver cannot anymore be the good driver when vulnerability is rethought. But also it's important to see how this what is fair, what is allowed, what is kind of right on the road is part of the way, and narrations are part of the way participants make sense of those schemes. And these two pairs that we identify in terms of the good driver, responsible cyclist, as one way in which the schemes will be narrated and contested, and that questions around responsibility, legality, morality are important in the discussions around the schemes, because they somehow convey fears, perceptions, and experiences, and help us understanding why people might oppose or might support the schemes, and how can we communicate them better. And it's also, I think, it's very interesting so that it is at the level of language and the level of discursive creation that a lot of the controversies produce and reproduce, and that's where a new kind of discussions around what is allowed on the roads can be kind of had. And I think to conclude, it's also interesting to see how certain type of kind of stories about what the LTN is can push participants and us to think more about the others and kind of othering the others rather than opening a dialogue on what a future neighborhood could be and how different kind of being together in that neighborhood could be. So, and how can we kind of think about disrupting those narration and perhaps propose a different one. And that's it. And again, the QR code if you want to know more about the study. Thank you.
Fantastic. That was really interesting insight. Thank you, Celia. I have a quick question myself before, whilst everyone else thinks of their questions, I'm sure. Has there been a similar study done in another country? Because it does seem like there's in the certain areas of social media, and then that gets reported in the press, this sort of conflict between the cyclists and primarily car drivers. But in other parts of Europe where there's more cycling, or they might have similar kind of LTN type things, has there been a relevant study that's looking at the kind of same kind of thing around cyclists versus car drivers' perceptions of each other?
I'm sure there are many. I don't have anyone that uses the same methodology coming directly to mind, but certainly there are, and I think it is true that in some contexts the level of kind of moral opposition might be slightly different, but this kind of pair that we call of the cyclist and the driver recurs in the literature as well. So
right.
There is definitely other studies, for example, that have been using the same methods to look at videos in which like they look at this specific kind of interaction between like someone driving a car and someone cycling, and how they kind of enter in conflict, and it's kind of recurring as a pair. Although, yeah, I'm not aware of any specific study looking at this in the same way at the moment.
Okay, brilliant, thank you. Is there anyone else got any questions? Or we can open it up for wider discussion. If I invite Asa and Rachel back onto the screen, so if anybody has any particular questions for Celia, or we could start arranging a study with Mike. Basically any thoughts, because the idea now is that we can spend some time discussing. I can just wrap up the recording as well if we want to talk more freely without that being recording. So I'll just say thank you for your time, everyone, and I will end the recording now so we can have a more open discussion if that's more comfortable for people.